Your Excellencies, distinguished guests, members of the media, and partners, a very warm welcome to the start of today's program. A special thank you to members of the media for your presence here today. My name is Joy Ruwodo, and I'm Senior Director for Public Affairs at the End Fund. I welcome everyone who's here today with us in Abu Dhabi, as well as all those who are joining us from all over the world online. And of course, thank you to the Crown Prince Court and to the Federal Youth Authority for graciously organizing and hosting us in Abu Dhabi on this occasion. I found myself reflecting on how it has been just a few short months since we were all gathered here to celebrate the achievement of Niger's milestone and their milestone toward elimination of onchocerciasis. It seems to me that these celebratory gatherings will become increasingly frequent over the next several years as countries continue to meet and surpass the WHO 2030 elimination targets, hoping, of course, to end the burden of neglected tropical diseases for all. And what better way than for us to, as a community, come together after these recent successes and to welcome the commitment from the Helmsley Charitable Trust that demonstrates emphatically that we are committed until every last person is free of the burden of NTDs. NTDs are usually not fatal, but they very often will cause lifelong pain, disability, which can include blindness and the inability to walk. Effects from NTDs can also result in social isolation, in stigmatization, as well as significant economic cost to societies. For children, NTDs can lead to malnutrition, to cognitive impairment, to stunted growth, and even the inability to attend school. The good news, though, is that they're completely preventable and they're treatable. With effective methods that are generally available, they're inexpensive, and they're highly impactful. We often say that treating NTDs is the best buy in public health. Just for 50 US cents per person annually, we can actually bring these diseases under control, and we can even eliminate them. For example, initiatives like school-based deworming programs have shown that children can increase school attendance by 25%. I'll take a moment to add a little bit of context, because we're at such a pivotal moment in the fight against NTDs, and I cannot overstate the importance of this window of time. In the 10 years since the historic 2012 London Declaration on NTDs, the world has come together to make tremendous progress against some of the world's most neglected diseases. 34 countries have eliminated at least one NTD, bringing the total to date to 43 countries. And 600 million less people require NTD treatment than did before these programs began. The Kigali Declaration builds upon the goals established by the London Declaration, and it was launched just this year on World NTD Day. And it places agency and ownership in the hands of individuals and of communities. But perhaps the most important observation for me is that it serves as a catalyst to generate firm stakeholder commitments to reignite momentum toward the targets that are set out in the World Health Organization's 2030 NTD roadmap. We have another key milestone in a few weeks from now, in June, alongside the Commonwealth Heads of Government meeting, CHOGM, which is taking place in Kigali. Stakeholders from national governments, as well as from the private sector and civil society, will gather at the summit, and the summit is on malaria and NTDs, to reaffirm their commitments to eliminate NTDs once and for all. In the N-Fund's capacity as a trusted mobilizer for private capital, our commitments are multi-pronged. The N-Fund will continue to partner with stakeholders across the NTD ecosystem, from our donor partners like the Helmsley Trust, to those who provide critical resources to sustain NTD programs, to the implementers that support the execution of programming in countries, and to achieve the disease-specific goals. An end to NTDs is actually possible, but not without the close collaboration of the entire NTD ecosystem. So we must continue to listen, to inspire, to challenge one another to rise and to meet our shared goals. I think the next hour will offer a platform for us to do just that. And with that in mind, I would like to transition to introduce our first speaker today. It's my distinct pleasure to welcome you and introduce Fikre Seife, who joins us all the way from Ethiopia to discuss how contributions like the one from Helmsley Charitable Trust can help to sustain and even unlock additional country capacity and to accelerate progress towards the NTD strategic plan. Fikre, I welcome you on stage.
His Highness Sheikh Mohammed bin Zayed Al Nahyan, the Crown Prince Court, dear Talal Al Ramahi, the Crown Prince Court Director, dear Walter Panzer, Helmsley Charitable Trust, dear Alan McCormick, the Independent Board Member, dear Dr. Carol Carotu, Vice President of the Independent, distinguished guests, members of the media, partners, ladies and gentlemen. Good morning. It is indeed a great pleasure and an honor for me to be here with you on the occasion of the Helmsley and Independent announcement event. On behalf of the Minister of Health of Ethiopia, I would like to express my most sincere thanks to the organizers of this event for inviting me to deliver a few remarks on this very important occasion. As you all know it very well, worldwide neglected tropical diseases affect 1 billion of the most vulnerable and marginalized people and cause immense suffering and devastating social, health, social, and economic impacts. Ethiopia is disproportionately affected by a century-long scourge of multiple neglected tropical diseases as compared with other developing countries, including sub-Saharan African countries. A dozen NTD inflict morbidity, mortality, and disability on the most disadvantaged population groups in our country and negatively affect the socio-economic development. Ethiopian citizens and communities affected by this disfranchising diseases are subject to severe stigmatization, isolation from social and cultural life, and are vulnerable for mental health problems. Recognizing the fact, the government of Ethiopia has established a program coordination office at all levels of the health service delivery and has launched a well-designed national strategic plan to combat NTDs since 2013. Considering the importance and significance of the program and our commitment to leave no one behind, the performance of the NTD program is being closely monitored by the high-level ministry officials in the national government and the regional health bureaus. Significant strides have been made since the launch of the National NTD Strategic Plan in 2013. To mention some of the program successes, national survey have been completed in all affected districts of the country, and disease prevention and control interventions have been implemented in all non-endemic areas. To date, more than 65 million people living in affected regions and districts have received treatment for one or more entities over the past several years. A total of about 680,000 people received eyelid surgery to prevent blinding trachoma across the country. Over 22.6 million people living in 268 trachoma endemic districts no longer require antibiotic treatment. More than 2 million people living in 33 districts no longer require mass drug administration for lymphatic filariasis or elephantiasis. More than 1 million people living in 8 districts no longer require treatment for river blindness or onchocerciasis. At this juncture, I would like to extend my sincere appreciation to our generous donor, Helmsley, for the long-time financial contribution through the End Fund in fighting against trachoma, onchocerciasis, lymphatic filariasis in Ethiopia. Helmsley is one of our long-time donors for NTD program. To cite some of the programmatic achievements made by the direct support from Helmsley, over 52,000 people received corrective trichiasis surgery. Over 5.3 million at-risk people were being treated for onchocerciasis each year for the last couple of years. More than 1 million at-risk people were being treated for lymphatic filariasis each year. In addition to these different impact monitoring surveys for onchocerciasis, lymphatic filariasis, and programmatic operational researches are part of the Last Mile Fund support in Ethiopia. The other most important support made by the Last Mile Fund is country capacity building activities, including providing technical support for epidemiological and entomological laboratory workers, sharing best experience among different endemic countries, strengthening cross-border collaboration between Ethiopia, Sudan, and South Sudan. While energizing ourselves with these achievements, we set ambitious milestones for 2025 and an ambitious target for 2030. This includes elimination of lymphatic filariasis as a public health problem by 2070, elimination of transmission of onchocerciasis by 2030, and elimination of trachoma as a public health problem by 2030. Aside this, the program encounters socio-environmental challenges, including insecurity in some parts of the country and the ongoing COVID-19 pandemic that delay the achievement of disease elimination targets. Your Excellencies, while joining our hands towards the last mile to success, strengthening the national health system and transitioning through mainstreaming into the healthcare delivery system is critical both to sustain achievements and ensure universal health coverage. To this end, the Ethiopia government will strive to assure NTDs get responsive and accountable attention, not only at the policy level, but also at lower structures and communities for extended support to reverse the country-long scourge of entities. Moreover, efforts are underway to mainstream and integrate NTD program activities into existing healthcare delivery system in the country so that NTD prevention, control, and elimination progress can be managed in sustainable manner until the end game is achieved. Finally, I would like also assure you all that the government of Ethiopia is committed to continue assuming its leadership roles more than ever until entities are consigned to history by realizing the WHO roadmap 2021 through 2030. I thank you.
Thank you very much, Fikre, for shedding additional light on your country's incredible progress and goals towards elimination. I'm particularly inspired by the story of progress. The statistics that you shared suggest that we are marching towards an end. So thank you very much for that. It's really clear, I think, in what Fikre's remarks were, that Ethiopia is firmly and boldly committed to ownership of its NTD programs. It sets a powerful example to other countries in the region, and it underscores the importance of the integration of NTD goals into the broader health system's goals. Country ownership is something that I think in the NTD community we have really worked to institutionalize. We've seen time and time again that the most effective and lasting NTD programs are ones that are designed, led, and sustained at the national and community level. It's also incredibly powerful in uniting stakeholders from across sectors to work together to reach a common goal for their communities. I'm very much looking forward, Fikre, to digging into some of this further, especially when we get to the panel discussion and perhaps the Q&A. Your remarks have certainly sparked questions in my own mind, and I imagine for other panelists as well. We're looking forward to a robust discussion later. Next, we'll be listening or hearing from Tala Al-Ramahi, who is here in an official capacity representing the Crown Prince Court of Abu Dhabi, with whom we have worked for several years to execute on the goals of the Reaching the Last Mile Fund, an initiative launched by His Highness Sheikh Mohammed bin Al Nahyan, and it's fast-tracking ongoing efforts to end river blindness and lymphatic filariasis in several countries across Africa and the Middle East. Tala, I welcome you on stage.
Thank you, Joy. Distinguished guests, our valued partners and stakeholders, and esteemed members of the media, good morning and Ramadan Kareem. On behalf of the Crown Prince Court of Abu Dhabi, I would like to express my sincere gratitude to you all for attending today. We really do appreciate your presence in what is a significant occasion and milestone in the Reaching the Last Mile Fund journey. As you will see in the video a little later, the Reaching the Last Mile Fund, better known as RLMF, has made incredible progress since its inception in 2017, where this initiative has been paving the way for the global elimination of river blindness and lymphatic filariasis in 7 countries in Africa and the Middle East. During this period, we have witnessed remarkable acts of generosity and kindness from a variety of organizations and from the wider communities we work towards disease elimination that is driven by the personal commitment of His Highness Sheikh Mohammed bin Zayed, the Crown Prince of Abu Dhabi, and through key global health programs. These efforts have all contributed to historic milestones, and today we celebrate a new chapter in our journey at RLMF, where we will shortly announce a major philanthropic donation by the Leona M. and Harry B. Helmsley Charitable Trust towards Reaching the Last Mile Fund. Before I explain what this donation means to RLMF, I would like to provide an overview of what we are aiming to achieve and why. The Reaching the Last Mile Fund is a 10-year global partnership launched by His Highness Sheikh Mohammed bin Zayed, Crown Prince of Abu Dhabi, continuing on the commitment of our late founding father, His Highness Sheikh Zayed bin Sultan Al Nahyan, to eliminating infectious diseases. The fund is supported by a number of philanthropists and organizations, such as the Bill and Melinda Gates Foundation. RLMF delivers preventative treatment and focuses on ways to accelerate progress towards elimination efforts, particularly on river blindness and lymphatic filariasis, whether this is from investing in disease mapping efforts to supporting advanced lab facilities and cross-border collaborations. Most of us in this room may not have come across a person who is physically suffering from these NTDs face to face, as unfortunately the burden of these diseases are based in Africa. While there are over 218 million people worldwide that are at risk of river blindness, 99% of them are living on the African continent. Furthermore, in the same continent, there are over 850 million people in 50 countries who are at risk of lymphatic filariasis. I'm going to pause until the fire alarm, hopefully. Okay. As a prosperous nation, the UAE has always provided a helping hand to countries around the world, and thanks to the guidance of our leadership, the country has been committed to fighting NTDs for more than 3 decades. The Reaching the Last Mile Fund has been a key pillar in driving change for the better, focusing on the elimination of river blindness and lymphatic filariasis through a unique and collaborative approach. With the support of local governments and the World Health Organization, the fund is working with pharma companies to provide drugs for prevention and treatments, while also supporting disease elimination mapping and supporting lab training for technicians. Today, thanks to the donations that we have received, we have rolled out key health programs which have provided more than 500,000 treatments and helped over 700,000 health workers undergo successful training to help prevent these NTDs. One of the major milestones in the fight against NTDs was witnessed in the UAE through an announcement that was made in December of last year, that Niger is completing the necessary evaluations in line with guidelines from the World Health Organization to certify the elimination of river blindness, providing a proof of concept that elimination is possible. We are very grateful to the Helmsley Charitable Trust for their significant contribution in accelerating this progress and these efforts. Not only will this go a long way in helping to achieve our goals, the Trust's example of leveraging its $8 billion endowment through a series of global partnerships to help mitigate a range of health challenges worldwide while supporting some of the planet's most vulnerable communities is truly inspirational. I'd also like to personally thank Walter, board trustee, for both his belief in and advocacy of Reaching the Last Mile Fund's mission and vision, and for his work in realizing the Helmsley Charitable Trust donation. So thank you, Walter. We acknowledge and value your efforts during your visit to the UAE last December, where Walter spent his time taking a deep interest in the fund's activities and motivations in a bid to truly understand our work and how to better support it. The Trust's support is a testament to how highly regarded Reaching the Last Mile Fund is worldwide, and another example of how organizations are willing to step forward and help even more people in the world's most impoverished communities. Our overriding goal is to continue touching the lives of millions of people around the world by ending river blindness and lymphatic filariasis so they can live dignified lives, and this requires a collective effort from all of us to make a positive difference. While our work to date has successfully impacted millions of people, it is imperative that we keep focused and committed to our elimination efforts and objectives. With this in mind, we call on the global community to help us amplify and broaden the fund's considerable efforts so far. We hope that other like-minded philanthropists and organizations will join us to create a global, powerful collective, one that can help us go even further in realizing the ambitious yet achievable goals that we set ourselves, so that with every step we take, we are a step closer to successfully reaching the end of this elimination journey. Together, we can help end river blindness and lymphatic filariasis and ensure a brighter and healthier future for millions of people worldwide. Thank you.
Thank you very much, Tala. I'm going to digress a little bit and say it is your composure that encouraged me to sit still. After that alarm went off, I had to fight the urge to run. So thank you. Over the course of our partnership with the Crown Prince Court, they have shown incredible leadership in providing just that regional and international support for humanitarian, developmental, and health initiatives that target countries and communities in need. I think I probably speak for both organizations in highlighting the value and importance, particularly in the NTD space, of the sustained and long-term partnerships. The work of His Highness and the Crown Prince Court to establish the Reaching the Last Mile Fund through the N Fund truly serves as a model for future long-term partnerships. I think the N Fund shares His Highness's vision for ending suffering caused by blindness and disfigurement from neglected tropical diseases, and we really look forward to many, many more years of partnership. Without further ado, I'm now excited to introduce Walter Panzera of the Helmsley Charitable Trust. It gives me great pleasure to have you here today to share what inspired your investment and to hear your hopes for what the investment will lead to. Welcome.
Thank you, Your Excellency, distinguished guests and partners, and welcome everyone. It is such a privilege to be here today and on this exciting occasion to be among leaders of the global fight on neglected tropical diseases. I would like to say a special thanks to Fikre Safayi, the National NTD Program Manager representing Ethiopia's Federal Ministry of Health. Thank you for your leadership, and thank you for traveling all this way here today. The Helmsley Charitable Trust has been working in sub-Saharan Africa for a number of years. To date, we have spent over $200 million improving lives of rural sub-Saharan Africans in many ways by strengthening healthcare, economic development, and over $38 million in the past of elimination of neglected tropical diseases. So it's my honor here to join all of you to announce that the Helmsley Charitable Trust is committing $22.5 million to the Reaching the Last Mile Fund. The whole team at, thank you. The entire team at Helmsley Charitable Trust is truly inspired by the Reaching the Last Mile Fund and inspired by everybody coming together. Through our investment, through our $22.5 million investment, hopefully we will achieve total elimination of LF and river blindness in Ethiopia and the border countries that surround. We expect this to be in about a 3-year time frame. So we're very ambitious as well with the whole process as well. Collaboration is key. That is what makes the RMLF fund so attractive to be part of. This is something bigger than everyone. Not one person, one organization, or one foundation could do this alone. This takes a global community to come together to solve a truly global problem that's devastating millions and millions of lives, mostly in sub-Saharan Africa, amongst the most vulnerable, the poorest of poor. As Tala said earlier, most of us will never have the opportunity to meet someone afflicted by these diseases. But these people count. All these people count. And the economic burden of getting these diseases is horrible amongst the people, amongst the countries. With this, by eliminating neglected tropical diseases globally, we can actually change make a change, and keep people living, keep countries and economies going stronger and stronger. Like I said, it's such an honor to be here, and I'm just so thankful for His Royal Highness to have the vision of starting this fund. Because without that vision, and the many catalysts like the Bill and Melinda Gates Foundation, and Elma Foundation, and the many others in this room to come together, we wouldn't be here. And we hope our funds act as a catalyst to bring even more funders here to achieve elimination of these neglected tropical diseases across 7 countries across sub-Saharan Africa. Thank you so much.
Thank you very much, Walter, for those remarks. I was never a fan of maths in school, and this is why you'll find me doing what I'm doing here. But something about poetic justice, I find myself here in a world where I'm reminded of maths, because I'm reminded of synergy, which said, I think the term was, the whole is bigger than the sum of the parts. And I think this is exactly what's happening here in the Reaching the Last Mile Fund. So on behalf of everyone gathered here today, I'd like to say thank you again, Walter. We welcome this investment to accelerate progress and treatment towards elimination of onco and for lymphatic filariasis. The collaborative action and commitments demonstrated by the partners and also everyone seated here at this table in the community needs to now fast-track the efforts to get over the finish line. And I think that's why it's so ironic that it is the Reaching the Last Mile Fund. The N Fund is so proud to provide a platform that allows for these types of investments to be pooled and to be applied to NTD programs that will invariably ensure that people are able to live healthier, freer, safer lives. Finally, and no less, I'd like to introduce Alan McCormick, who's a board member of the N Fund, representing the N Fund today, to share his perspective on the value of collaborative philanthropy and the effort of Helmsley's contribution. So welcome on stage.
Good morning, everybody. I think I can still just say that. And thank you and welcome your excellencies, distinguished guests and partners. Can I also thank Vicre for coming all this way to share about your country's journey. It's remarkable what you've accomplished, and we're all excited about what you'll accomplish in the future as well. And finally, thank you to our partners at the Crown Prince's Court. You've been bold, steadfast, and visionary in your efforts, and we're truly grateful for your partnership. I'm particularly excited to be with you here today because of the commitment from Walter and the Helmsley Charitable Trust. And it's a manifestation, the investment that you've made is a manifestation of the vision that we at Legatum had in founding the N Fund, which is now 10 years ago. Legatum's NTD journey began in 2006 with a chance reading of an article on philanthropy. And in it, someone said, with a little bit of modest funding and imagination, we could have an outsized impact by supporting the integration and distribution of readily available drugs to treat several diseases at the same time, through a new approach, which is then called mass drug administration, or MDA, as we now call it. At the time, NTDs were truly neglected diseases. Few other private funders were active in the space, although it seemed like uncharted territory. Being an investment organization, we at Legatum also felt that this was an opportunity to invest in the lives of many, and it was too good to miss. And so we funded 2 national-scale pilot programs in Rwanda and Burundi. And after seeing their remarkable success of these investments, we hope that others might be inspired to join this model. The leverage from our philanthropic investments combined with generously donated medicines from the drug companies was a powerful incentive. And so, in 2012, we created the N Fund to build a community and grow the pool of privately available philanthropy for NTDs, while ensuring it was put to the best use, to the best possible use in support of the most effective country programs. Now, fast forward 10 years, and we can see the outcomes. Hundreds of millions of lives improved, and over 30 country programs supported. Of course, this wouldn't have been possible without the hundreds of millions of dollars which have been contributed from the End Fund community, and we are particularly, again, grateful to the Crown Prince's Court for their vision and steadfast support in mobilizing resources and driving them to where they can be best used. As we look to the future, it's incredible to be deepening our collaboration with the Helmsley team, to be broadening our community, and to be looking forward together towards an NTD elimination finish line that is clearly in sight. When creating the End Fund, it was crucial to us that it had the flexibility to grow, given the scale of the NTD challenge. This is why it's been so inspiring to see the evolution into a structure that efficiently manages a growing number of funds, each with their own disease and country focus, like Reaching the Last Mile Fund, and complementary opportunities to contribute to NTD elimination. Through the End Fund platform, we're seeing huge network effects as the expertise which comes from over a decade of experience along with this capital will combine to support different but related NTD elimination goals across a multitude of countries and contexts, as evidenced today by this exciting news around Reaching the Last Mile Fund. One of the most important ingredients to me in the End Fund's growth are its founding values. This is something which many have drawn and which has given rise to an extraordinary community of NTD champions spanning many countries, cultures, and perspectives. One of our core principles is building a culture of honor, honoring donors, implementers, and communities in which we work. It comes from the belief that every life is of infinite value, everyone imbued with dignity and a divine spark which should be honored and nurtured. As a consequence, we have sought to build a culture that honors the communities in which we work, that recognizes that they're best placed, they're the best determinants of their own destinies. In support of this, we're now seeing a growing movement which includes donor pharmaceutical companies, investors, governments, scientists, doctors, and implementers, all trained on one goal: serving their communities so that we will see the end of these diseases in our lifetime. I have the pleasure of knowing Walter and Tina Panzera from the Helmsley Trust, I think for almost a decade now. They share these values and they share this goal. They've been wonderful, thoughtful partners with a great commitment to programmatic excellence. We are sharper, better, and more effective because of the questions they ask and the contributions they make, although the team may not always feel that way. But no, we are sharper and better. Excuse me. From the End Fund's inception, we believe that NTDs could be ended in our lifetime. NTDs have needlessly held back human progress for millennia, and the End Fund was founded on the principle that private philanthropy could change this. Today's investment from the Helmsley Charitable Trust fills me with renewed optimism that this is indeed possible. Indeed, we are already seeing this happen in front of our own eyes. And thank you to everyone here and online for making this possible. Thank you.
Perhaps the first time I'm having to pull this down a little. Thank you very much, Alan, for your reflection. It really is humbling to look at the progress of the End Fund along with Legatum. The End Fund this year celebrates 10 years of existence. And throughout it all, Legatum has been there from before the End Fund was formed. So thank you for that, for the initial vision and investment that sparked a flame that has mobilized countless other activist philanthropists. We've collectively fostered a diverse, passionate and talented network that is united under the shared goal of disease burden elimination. So at this point of our session, I'd like to break to share a screening of a very powerful video. I think many here have heard words mentioned that are unfamiliar: onchocerciasis, lymphatic filariasis. And so it's the opportunity now to be able to see how it really impacts real lives and real people. And you can see the incredible work and progress that is being driven by the Reaching the Last Mile Fund. So if you can all turn to the screen, thank you.
ልጅ ሆኜ የሆነ ጫማ አድርጌ ወደ አቃጠለኝ ሲያቃጥለኝ አውጥቼ መራቄን ተፈተፈ ብዬ እግሬን ቀብቼ ወደ ሰፈሬ ሲሄድ እግሬን አመመኝ። ያ መድኃኒት ከታሰረልኝ በኋላ የቆሰለው እንደ መዳን እንደ መድረቅ እንደ መሰብሰብ ሆኖ ልጅ ሆኜ ራሴ ስማር እኔ ራሴ እስከ 4 ተምሬያለሁ። ስማር ደስተኛ ሆኜ እግሬ እንዲህ ሳይሆን ትምህርት እስከ 4 ተምሬያለሁ። ልጅ ሆኜ በጣም የልጅነቴን ሳስብ ምንም አይመጣጠንልኝም። አሁን ተመስገን። ቤተሰቦቼ ያው አሁን የሚረዳ ክፍል እኮ ያለው የሚረዳ ቤተሰቦቼ እንደኔ ለቅሞ በይ ናቸው። የሚረዱኝ ነገር የለም። እግዚአብሔር ሆይ እንደሰው ፈጥረኸኝ ይህንን አስቀያሚ ነገር ሰጠኸኝ ብዬ በራሴ ሰው ሳይሆን ራሴ በራሴ ይሰማኛል። እሸማቀቃለሁ። ማህበራዊ ኑሮ ስኖር ከሰው ተጨምሬ ሲሄድ በቃ አንዳንድ ነገሮችን ሳስብ ራሴን አጥፊ ይሰማኛል። እኔ አሁን ለዘር ይሄንን ተሸክሜ አይደለ የመጠቃቀሻ ሆነው ብዬ በጣም አዝናለሁ። በራሴ ዙሪያ ግን አውጥቶም አንዳንዴ ከሰው ስጣላ አንዳንድ ሰው ሲሰልኝ ደግሞ ሙቺ ይለኛል። እንጂ እኔ እንዲሆኛለሁና ልጆቼም እንዲሆኑ ብዬ ፍጹም አልኩ። በኔ ያብቃል። እኔ የደረሰብኝ ፈተና በኔ ይለቅ፣ ወደ ልጄ ወደ ዘር አይሄድ። እነሱ በተለይ በሰላም ይደጉልኝ፣ ደስተኛ ይሁኑልኝ፣ ይማሩልኝ፣ እሱን ፈልጋለሁ።
L'onchocerose, c'est ce qu'on appelle la maladie des rivières. On a étudié maintenant son épidémiologie, comment la maladie arrive, comment ça évolue et ce que ça fait chez l'homme et les dégâts que la maladie cause chez l'homme. Mon nom, c'est Amadou Fall Sek. J'étais le chef de l'équipe nationale d'évaluation épidémiologique du Sénégal. J'ai choisi aussi ce village particulièrement à cause d'un vieux qui était là, qui nous a dit, 2 ans après, quand on a commencé et qu'on a vu les résultats, le vieux là nous a dit, malheureusement pour moi, vous êtes arrivé en retard. Mais si vous étiez arrivé tôt, je ne serais pas aveugle. J'ai choisi ce village aussi de par sa prévalence quand on a commencé le traitement. On avait une prévalence de presque 66%. Chaque 100 personnes, les 66 étaient atteintes d'onchocerose. Avec la lutte antivectorielle, les paysans eux-mêmes se sont rendus compte que les stimuli ont diminué. Il y avait moins de piqûres. Donc la nuisance a diminué. Maintenant, dans ce village-là, la dernière fois que nous avons évalué, on n'a trouvé aucun positif. Au début du programme, on ne parlait pas d'élimination. On parlait de contrôle. On voulait contrôler la maladie. Mais au cours de ces 6 années, on s'est rendu compte, vu les résultats que nous avions eus, qu'il était possible qu'on était en voie d'éliminer la maladie dans cette zone. Et je crois que si nous persistons, si nous continuons à fournir des kits, on pourra éliminer l'onchocercose dans cette zone au Sénégal.
Thank you to our production teams and to the Reaching the Last Mile Fund for making this video possible. I think I can speak for most people in the room today when I say that hearing the impact of the work at the community level is especially powerful and moving. Our hope is that we'll have future generations that will never have to know of the names onchocerciasis or lymphatic filariasis because they will cease to exist, which is why it's so important as we welcome this new funding stream today that we remember to always bring our focus back to the people that these resources can reach with sustained investment. For those of you joining us virtually, the video just shared will be available on the NFund YouTube channel. And I think we're going to pause shortly because we will be moving to our panel discussion. For easily accessible information on the NFund website is available for those that want to dig in a little more about the NFund, the Fund of Funds, the Reaching the Last Mile Fund, and the NFund website is end.org, which is very simple. But I'm excited for us to move on to the next segment of the event, which is now a roundtable discussion where we'll sit on the stage with all of our panelists and we'll have a Q&A, and members of the media may also ask questions shortly after. So if you can bear with us as we have the tech team come on stage to help us to set up. Thank you. Very much. Looks like the mics are on. So I think we can start off the segment with a question for Fikri. Ethiopia's third national NTD strategic plan for 2021 to 2025 that was released this past November lends particular focus to NTD program sustainability, coordination, and partnerships. We've spoken today about how intertwined these goals are, requiring the participation of cross-sector stakeholders. So I'd love to hear from your perspective some of the elements required for successful partnership between ministries of health and the private sector.
Thanks so much, Joy. As Joy already mentioned, we have developed the most recent, the third NTD strategic plan, which will be serving from 2021 until through 2025. Under this strategic master plan, the most focus is program sustainability, including workforce capacity building, domestic resource mobilization, and multi-sectoral collaboration. Those are the 3 pillars which are briefly reflected in the master plan. So As the previous speakers said, multi-sectoral collaboration and engagement of, community engagement is very significant in combating NTDs. NTDs are, by the way, when we say neglected tropical diseases, it's not the disease which is neglected. Rather, it is the community who is neglected by politicians, neglected by policymakers, neglected by the medias, and so on. So without multi-sectoral collaboration, without joint work across different stakeholders, including governmental, non-governmental, and public-private parties, including the community itself, we wouldn't be able to reach the target set by each countries. So as a direction from the World Health Organization, all the member states, including my country, Ethiopia, developed a strategic plan. Coming to the specific to your question, yes, private sectors has a great role in combating diseases. For example, we saw the video, an embarrassing video about lymphatic filariasis. If we consider that woman who has a swollen leg, they can't wear ordinary shoes as I do and as you do. So they need a special type of shoe, but it's not available in the country, it's not available, accessible for them. So we are approaching private shoe producing companies to produce comfortable shoes for those patients with minimum cost. In other words, on another hand, NTDs are diseases of poverty. Basically, it's related to the water, hygiene, and sanitation. If we engage private sectors, including the wealthy, local people, and the media, by the way, the media have a big role in advocating NTDs. The people, the communities themselves, they didn't perceive NTDs as a preventable disease. Rather, they perceive it is related to something God has given to them, and so on. So media, private medias, we have local television medias, and we have local radios, which is accessible to the community. So if we engage those media owners and journalists like you, so awareness creation and political, advocacy for political leaders is very crucial. So multi-sectoral is by far the most important thing in fighting diseases. Thank you.
Thank you very much, Fikre. You've made a number of strong points, and I think importantly, because we have the media present here today, to actually acknowledge that one of the biggest challenges when it comes to neglected tropical diseases and why we struggle to push the needle is because they remain largely unknown and under-prioritized. And the only way that we can get to that point of there being more awareness, that more Walters and more Legatums, more Helmsley charitable trusts can know about the need, is through partnership and support from the media. So thank you to the media in the room today. I think I will move on, Tala, perhaps to you, because we know that the CPC, the Crown Prince Court, has been a trailblazer in impactful investments to eliminate NTDs. What I'm curious about, especially because of what we've just been discussing with Fikre about the difficulty of people being aware of it, how did the leadership of the Crown Prince Court happen upon NTDs as a priority in a world full of a myriad of problems?
Thank you, Joy, for this question. We talk about Reaching the Last Mile Fund, which is a fund that His Highness established almost 5 years ago, and through the generous support of many philanthropists, including Bill Gates and the Helmsley Trust now coming on board. However, the CPC and His Highness Sheikh Mohammed bin Zayed's philanthropy actually is actually a legacy of our founding father. And these disease elimination efforts and partnerships have begun almost 3 decades ago. This was triggered by a first meeting between our late founding father, Sheikh Zayed bin Sultan Al Nahyan, when he met President Carter during an official trip to the UAE. President Carter at the time was making the case for support on guinea worm elimination, eradication efforts. Another NTD that many people may not be aware of, but also at the time devastated large parts of sub-Saharan Africa. Thankfully, through that partnership and through many other global partnerships on guinea worm eradication, we now only have 15 human cases of guinea worm worldwide. So this is a significant effort, but this is really the partnership that paved the way for Sheikh Mohammed bin Zayed continuing this legacy on disease elimination. We talk about lymphatic filariasis and river blindness as a focus of Reaching the Last Mile Fund. However, His Highness's philanthropic portfolio also expands to other diseases that are within the last mile of elimination. Diseases such as polio and malaria as well have been big focuses of His Highness's portfolio and will continue to be big focuses of His Highness and his philanthropy and portfolio, primarily because for NTDs, these are diseases that are obviously neglected. From the name, you can tell a story about diseases that are underfunded, that many people don't know about because they don't inflict people from communities that might be more privileged. And His Highness is very passionate about making sure that these diseases do not continue to be neglected and that we can bring on more partners and more philanthropists that can join us in this effort to help eliminate these diseases. And we're very thankful that we're able to announce an even new partnership with the Helmsley Trust to accelerate this momentum.
Thank you so much for that response. I think all I can get from it is just how visionary this was in being able to see, and Fikra touched on it, that it's not just the diseases that are neglected, it's the people that are neglected, the affected communities that are neglected. So for His Highness to have been able to see them, to me, is remarkable. And then I think I'll move on to you, Alan, because you mentioned earlier on Legatum Group's motivation in establishing the N Fund a decade ago. And I think similar to the experience with the Crown Prince Court, for me, it speaks about enduring partnerships. It speaks about commitment for the long haul. So I'd love to hear from you why this has actually been a successful and gratifying investment for Legatum, why you've stayed, why you continue.
Well, Walter made this remark earlier on when we were talking. It's the primary reason why we've stayed is because this is one of the best returns on investment that you can get anywhere in philanthropy. I mean, there is the phrase that this is the best buy in global health. You put $1 to work here and you can change 2 lives. That's very, very unusual. In fact, when we were originally doing some very crude analysis many, many years ago, we had this very basic metric that we used, which was cost per life change. And we had funded probably 1,600 projects in 100 countries across many, many different things, from education through to disease, through to clean water, all sorts of things. And the average cost of our philanthropy was coming out at $12 per head. And so when we saw something that could change a life for 50 cents, that seemed really remarkable. And so we've stayed because of the ROI, but I think we've also stayed, if I'm honest, for the relationships. It's been an amazing journey relationally, because you sort of put your foot into a river and you set off from the banks and you don't really know where it's going to take you. And we've just had the pleasure of meeting extraordinary people, where you've got scientists and you've got philanthropists and you've got governments and you've got incredible development professionals, all coming together to try and make a contribution. And that's just really rewarding and it's fun. So that's another reason why we stayed.
I love it. I promise you we do not pay him a cent to say what he's saying. But as he was talking about just also the connections and the collaboration, I think one mention I didn't make today is about the pharmaceutical companies that make huge contributions of the medical consumables, the drugs that are distributed for mass drug administrations. And without their contribution, we wouldn't be able to do this at 50 cents per person per year. So I think it's really a fantastic collaborative effort. And I'd like to now move to you, Walter. You mentioned that you were a first responder at home in the US. And so my curiosity is, how has this informed your commitment to strengthening health systems and perhaps even to investing in the Reaching the Last Mile Fund?
Absolutely. As a former paramedic, former law enforcement officer in both the urban centers of the United States and...
Sorry, one second. Thank you.
All right, is this better?
Much better.
Okay, as a former paramedic, former law enforcement officer who worked in not only the urban centers, but worked in the very rural most parts of America, I saw huge differences between urban and rural. I saw things in rural America burden people more, just like out here, out in Africa. You see the disease burdens happen a lot more to the rural populations. And anytime you can really key in and be able to put something so simple like mass drug administration, something that can be done with the whole community, you're making a big impact. You're making a huge difference. And it's something that's the technology is already there in the community. You don't have to bring anything besides the drugs, besides the expertise, but you train the local community and the MDAs. You train the folks on how to do school-based MDAs and whatnot. But that's one of the areas where I took it from, where it's easy to use in the rural areas. And by doing that, it's made for everyone, you know. It's made, the MDAs are simple, the drug elimination's easy. And going back to collaboration, I know you asked on the first responder, but it's the collaboration that's the key on this. It's everybody coming together. It's coming together as a fund. This is, as I mentioned in my speech earlier, it's everybody coming together, because this is something so big that not one organization can solve it. It's going to take partnerships like with Legatum, with the Bill and Gates Foundation, with His Highness's visionary thoughts of creating this fund to really bring people together. And that's the key, is the collaboration globally to end this horrible burden of disease.
Thank you. That's really powerful. So I could go on forever, because I'm actually just enjoying having this conversation. I find the conversations very productive. But because we're approaching the end of the day, and I can't actually see a clock, I suspect that someone will shout at me soon about the time. So I want to just open up the floor to give room for any questions that may come from the floor for any one of our speakers here today. And if the tech team can just assist me with mics, if anyone has a question to ask. Any questions from the floor? I'm getting a sharp nod about the fact that it is actually 12:30 already. So perhaps we can let our panelists go. And thank you so much for this engaging conversation. And I know that we will have a few moments at the end of this session for if the media is wanting to engage with any of our panelists one-on-one. They're very much happy to engage in conversations. What I could perhaps suggest that we move to, we have our Vice President, Dr. Carol Karutu from the N Fund, who can come on stage, please, and help us with just sharing some final thoughts while our panelists can go ahead and get comfortable.
Okay, thank you, Joy. and good afternoon, and Ramadan Kareem. Your Excellencies, on behalf of the NFund CEO, Ellen Agar, the NFund Board of Directors, represented here by Alan McCormick, our implementing partners, the governments in the countries where we work, and also the NFund staff, I'd like to express our sincere gratitude to the Crown Prince Court for your commitment to the Reaching Last Mile Fund, and even more so for organizing this event. Thank you very much. Today, we are here to celebrate. We are here to thank Walter and the Helmsley Charitable Trust for the catalytic $22.5 million that you funded to the Reaching Last Mile Fund. We are highly grateful. I'd like to reiterate that your support gets us really many, many steps closer to eliminating lymphatic filariasis and river blindness in the 7 Reaching Last Mile Fund countries, and especially in Ethiopia. On behalf of these 7 countries, and especially on behalf of Ethiopia, represented here by Fikre, thank you, Fikre, allow me to say shukran. We thank you because today, a woman far away will be saved from blindness. A man that you've never met and will never meet will not suffer from the stigma that comes from having a hydrocele. Again, allow us from the NFund, from the Crown Prince Court, to really say thank you for everything that you do for those that you'll never meet, but they will have a better life. Their children will have a much better life because of the support that you provided today. As I stand here, and as we conclude, as myself and the NFund, we truly believe that elimination of neglected tropical diseases, and especially these 2 diseases, lymphatic filariasis and river blindness, can be eliminated in our lifetime. What a privilege that we all have to get close to that. Thank you very much, and thank you, Joy, for the support.